It is 2:01 in the morning. The whole house is dark, but your brain is wide awake, replaying every worry from the last 10 years. You're doing the 3 a.m. math, calculating exactly how many hours of sleep you have left if you fall asleep right this second. If you've been looking at the ceiling since midnight, listen closely. This isn't just aging, and it isn't random. There is a biological reason your eyes snap open at this exact hour, and tonight I'm going to show you how to shut that system down. I'm Dr. Michael Kent. I've spent years working with adults who've been told that broken sleep just comes with getting older. It doesn't. What's happening to your body at night is fixable, and tonight I'm going to prove it. 7 things are quietly destroying your sleep. Some are happening right now at 2 in the morning. Some happened at 10 o'clock tonight before you even got into bed. And one happened yesterday morning before you had your first cup of coffee. We're going to fix all 7, starting with what's waking you up right now. Here is exactly what is happening in your body right now. Your primary stress hormone, cortisol, follows a daily curve. In younger adults, it stays low through the night and starts rising around 5 or 6 in the morning to prepare the body to wake up. But in adults over 60, especially those carrying chronic stress or a history of poor sleep, that cortisol rise starts earlier, sometimes as early as 2 or 3 a.m. And when cortisol rises, your brain switches on. That is its biological job. You didn't wake up because something is wrong with you. You woke up because your stress system is running on a shifted schedule. And here is the part that makes it worse. The moment you realize it's 2 a.m. and calculate how many hours you have left, your cortisol spikes again. Now your brain is problem solving. It is managing a crisis. And sleep is neurologically incompatible with crisis mode. This is why the harder you try to fall back asleep, the more awake you become. You are not failing at sleep. You are fighting your own biology with the wrong tools. The right tool is coming in tip 3. But first, there is one thing you need to stop doing right now that is making this 10 times worse. The worst thing you can do at 2 a.m. is look at the clock. I know that sounds too simple, but here is what happens the moment you see the time. Your brain shifts from rest mode into calculation mode. It starts projecting tomorrow, how tired you'll be, and what you have to do. That mental activity is the opposite of sleep, and once that loop starts, it feeds itself. Cover your clock. Turn your phone face down. Remove the time entirely from your environment. This is not a trick. It is removing a cortisol trigger. When your brain doesn't know what time it is, it cannot do the math. It cannot catastrophize. The alarm will go off when it goes off. Until then, the time is irrelevant. This one change alone has helped patients reduce their nighttime wake periods by 20 to 30 minutes within the first week. Not because they slept more, because they stopped actively preventing themselves from sleeping. Now, the immediate fix. Do this with me right now. Breathe in slowly through your nose. 4 counts. 1, 2, 3, 4. Now breathe out through your mouth. Longer than the inhale. 6 to 8 counts. 1, 2, 3, 4, 5, 6. Again, 4 counts in, 6 to 8 counts out. That extended exhale is not a relaxation technique. It is a direct biological signal. When your exhale is longer than your inhale, it activates your vagus nerve, the main pathway of your parasympathetic nervous system, your rest and recovery system. When it activates, it applies a brake to your cortisol response. Heart rate slows, neural activity quiets. 2 minutes, that is all it takes. Not 10 minutes of meditation, not a sleep app, just 2 minutes of this breathing pattern and your nervous system begins to downshift. Do this before you reach for your phone, before you get up, before you do anything else. 2 minutes of 4 in, 6 to 8 out. Let your body do what it already knows how to do when you give it the right signal. Now, tips 1 through 3 are about right now, tonight. The next 3 tips are about what you set up earlier that caused this in the first place and how to stop it happening tomorrow night. I had a patient, 73 years old, retired school teacher from Ohio. She had not slept through the night in 6 years, 3 different medications, every supplement her pharmacist had ever suggested. Nothing worked longer than 2 weeks. The first thing I changed for her cost nothing. It took 4 days to feel. And she called my office on day 5 to tell me she had slept 5.5 hours straight for the first time since her husband passed. Here is what I changed. Your body has a thermal requirement for sleep. To initiate and maintain deep sleep, your core temperature needs to drop by 1 to 1.5 degrees Fahrenheit. This is not optional. It is a biological trigger hardwired into your sleep system. When that drop happens, your brain releases the hormones that carry you into deep, slow-wave sleep. When it doesn't happen, you stay in that light, fragmented half-sleep. You drift, you surface, you lie there. Most American bedrooms run between 70 and 74 degrees at night. That is too warm. The target is 65 to 68 degrees. Start at 70 and drop it 1 degree every few nights until you find the range where you stop surfacing. And here is the deeper fix. 90 minutes before bed, take a warm shower or bath. When you step out, your body rapidly pushes heat to your skin surface. Your core temperature drops sharply, more sharply than it would on its own. That accelerated drop sends one of the most powerful sleep onset signals your brain can receive. That Ohio school teacher, bedroom at 67, bath 90 minutes before bed, day 5, 5.5 hours straight, not a trick, pure biology. At 9 o'clock tonight, before you even tried to sleep, your own ceiling lights were chemically overriding your body's sleep signal. Here is what most people never find out. The LED overhead bulbs in most American homes emit light in the blue-white spectrum, the same spectrum as noon sunlight. When that light hits your eyes after 8 in the evening, it signals your brain's internal clock to stop releasing melatonin. Melatonin is the hormone that tells your body it is time to sleep. Your brain was trying to send that signal. Your living room lights were shutting it down. The fix takes 30 seconds. After 8 in the evening, turn off your overhead lights. Switch to lamps with warm amber bulbs. Look for bulbs labeled 2700 Kelvin or lower. That warm spectrum has almost no impact on melatonin suppression. Your brain's sleep signal can finally build the way it is supposed to. Part of the reason you couldn't sleep last night was determined by what you did or didn't do yesterday morning, before coffee, before your phone, in the first hour after you woke up. Your brain has an internal clock called the suprachiasmatic nucleus. Every morning it synchronizes itself using one input, bright natural light hitting your eyes within the first hour of waking. When it receives that signal, it sets a precise biological timer. 14 to 16 hours later, it triggers your melatonin release for that night. When you wake up and stay inside in a dim bedroom, your clock does not synchronize. Your melatonin release that night is weaker, mistimed, and you lie awake at 11 wondering why sleep won't come, not realizing the problem was locked in at 7 that morning. Here is the remarkable part. The light intensity outdoors on a completely overcast morning is still 10 to 50 times stronger than any indoor lighting in your home. You do not need sunshine. You do not need a clear sky. You need outside. 10 minutes within the first hour of waking. That is the entire intervention. If getting outside is difficult, sit directly beside a large south-facing window or use a 10,000 lux light therapy lamp for 20 minutes with your morning coffee. 10 minutes in the morning protecting 5 to 7 hours at night. That trade does not get more favorable than that. The last tip covers 3 things your doctor likely never mentioned, because a 15-minute appointment runs on prescriptions, not explanations. That is exactly why this video exists. Magnesium glycinate. Between 40 and 60% of older adults are not getting adequate magnesium, partly because the modern food supply is lower in magnesium than it was 30 years ago, partly because medications common in seniors, certain blood pressure drugs or acid reflux medications, deplete magnesium as a side effect that is rarely discussed. Magnesium activates GABA receptors in your brain. GABA is your primary inhibitory neurotransmitter, the chemical that quiets neural activity. Without adequate magnesium, your brain cannot fully downshift. The racing thoughts at 3 in the morning, the light, fragmented sleep, the feeling of never quite reaching deep rest. These are frequently not psychological. They are biochemical. The form that research supports most for sleep is magnesium glycinate, not magnesium oxide, 200 to 400 milligrams 30 to 60 minutes before bed. Talk to your physician first, particularly if you have kidney disease. But if you've never had this conversation, now you know what to ask. Tart cherry juice. A controlled trial published in the European Journal of Nutrition gave adults with chronic insomnia tart cherry juice twice daily for 2 weeks. The result was a significant increase in sleep efficiency and total sleep time, confirmed by measurable increases in the body's own melatonin production. Tart cherries contain naturally occurring melatonin, tryptophan, and an enzyme that slows tryptophan breakdown so more converts into melatonin. 8 ounces in the morning, 8 ounces an hour before bed. Tart, not sweetened. Train your bed. If you have been struggling with sleep for months, there is a high probability your brain has learned to associate your bed with being awake. This is called conditioned arousal, and it develops automatically in anyone who has spent significant time lying awake in bed. The fix is called stimulus control. Your bed is for sleep only. No phone, no television, no lying there reviewing your day. And if you are awake in bed for more than 20 minutes, get up. Go to another room. Do something calm in dim light until you feel genuinely sleepy. Then return. The first week may feel like it is making things worse. What is actually happening is that every time you leave the bed while awake, you are preventing your brain from storing one more memory of wakefulness. Most people see meaningful change in 2 to 3 weeks. Not overnight, not instantly, but steadily, in a way that actually lasts. And unlike medication, where the benefits often fade the moment you stop taking it, these results stay with you. Why? Because you are not just masking the problem, you are retraining the very brain patterns that created it in the first place. You did not earn broken sleep just by getting older. That idea gets repeated so often that it starts to feel like fact, but it is not the full picture. Yes, your biology shifts over time, hormones change, sleep architecture evolves,